Thank you very much. Good afternoon, everyone. I'm privileged to be here. Actually, this is my first time of being here for this conference. And I must say that it took me 23 hours to travel here. But it's worth it. All right, so my name is Marijanatu Abdulai from the Ghana National AIDS and STI Control Program. And I'm here to present on my study titled Psychosocial Support Approaches and Quality of Life Among Older Women Living with HIV in Ghana. And this was a quasi-experimental study. And I'm also privileged to say that it is with the support of Dr. Tamara Jima of Northeastern University that I'm here. She's been so awesome. She's my mentor, and she supported me all this while. Thank you. So the presentation will take this outline. And by way of introduction, I would say that antiretroviral therapy has helped improve the life expectancy of people living with HIV, and older women are no exception, as we have witnessed in presentations this morning. In terms of access to ART, there's been a significant improvement in access to ART from 7.5 million that was reported in 2010 to about 31.6 million in 2024. Out of this, women contribute significantly to this, over 50%. And now when it comes to where this study was conducted, which is Ghana, as of the end of 2024, an estimated 350 million people were living with the infection, of which 70% of them are women. And in terms of those accessing treatment out of these women, 40% are older women, that is, they fall within the age brackets of 50 years and over. And so with the increase in life expectancy of people living with HIV and women, they are faced with a lot of social and psychosocial challenges, which we witnessed in most of the presentations that were made earlier this morning. And these challenges include age-related comorbidities like diabetes and hypertension, treatment complications from ARVs and other medications that they take to treat for HIV, social isolation. From our database, we realize that over 40 to 50% of women have lost their spouses, and so that is a lot of challenge for them. Healthcare disparities, stigma and discrimination, which is a big challenge in our setting, and then caregiving responsibilities for women. Of course, as part of the culture, it is a privilege for women to take care of their grandchildren, and already they are overburdened with challenges, and so adding that to it becomes a bit of a challenge affecting their psychosocial health. So to be able to maintain a good psychosocial support for these women, there's a need for us to adapt strategies and intervention to help improve this, their quality of life or their well-being. And from studies that have been published, we realize that mobile technology is one approach that has been utilized in Western countries to be able to improve the well-being of persons living with HIV. And of course, the World Health Organization in 2015 recommended the use of differentiated service delivery models to be able to help improve the well-being of persons living with HIV. In fact, Ghana as a country have adapted some of these interventions. Currently, as we speak, several interventions are being rolled out to improve the well-being of persons living with HIV. However, when it comes to older persons or older women living with HIV, there's a big gap there. The attention is focused on adolescent, pregnant women, and the general population. There is currently no targeted intervention in the country which seeks to look at the psychosocial well-being of older women living with HIV, and that itself is a gap. In terms of studies that has been conducted within the sub-region or within the country, currently there is no documented evidence of any interventional study conducted among older women or the older people living with HIV in the country. Most of these studies are targeted, cross-sectional studies which target adolescent, pregnant women, and some other populations, leaving these older populations out. And for that matter, it became relevant that we undertake this study. And I would say that this study actually was my PhD work, and I sought to look at how to assess the effect of psychosocial support among elderly people living with HIV. And so the data was teased out specifically for older women to analyze and present for this conference. So with the methodology that was used, it was actually a sequential exploratory mixed method approach, which looked at 3 phases. So the phase 1 was purely qualitative. The phase 2 was the development and implementation of the intervention. And in the phase 3 of the study, we now evaluated how effective those interventions were. And so the study was conducted in 3 health facilities within the Greater Accra region of Ghana, and that is the capital of Ghana. So if you look at this map, sorry. Oh, sorry. Okay. So this map is the map of Ghana, and the demarcated red area is where the study was undertaken with the corresponding study sites. So for the phase 1, it was purely qualitative, and we used focus group discussions and in-depth interviews. So the focus group discussions was held among women who are 50 years and above and had been on ART for at least 6 months. And so their lived experiences we explored to find out what exactly their quality of life was and what interventions we could put in place to ensure that they have a good quality of life. Having established that, we also spoke to care providers who attend to persons living with HIV, as well as implementers of the HIV program at the national and the sub-national level. And so we established that, yes, indeed, there was a challenge, and then we explored from them what means and ways we could use to address these challenges. And so having done that, we moved to the second phase of the study, where we now develop the interventions. And so in the second phase of the study, we developed 2 interventions. And these were short voice messages, which were sent out 3 times a week for a period of 16 weeks. And then we also packaged a second intervention, which was by designing or dedicating a specific day to attend to the unique needs of these elderly people living with HIV. So it's like they go to the clinic and their unique needs are specifically addressed, not the general clinic where they go and then everyone is attended to the same way. So this was the specific intervention that was designed for them. So this was rolled out for a period of 16 weeks. And after the 16 weeks, we had to evaluate the intervention to see how effective these 2 interventions had been. And so for the quantitative components of the study, the descriptive analysis was done using means and frequencies, and then we used linear regression to examine the factors that was associated with quality of life, as well as a DID to estimate the effect of the intervention on the outcome of interest, which was quality of life. So now for the background characteristics for the results, we realized that apart from age, all other variables, such as years of living with the condition, currently living alone, having a comorbidity, and taking other medications to treat HIV, there were significant differences in the control between the study arms at baseline and endline. Now, in terms of the overall quality of life, we use the WHO quality of life brief to measure the quality of life. And the tool is made up of 4 domains. We have the physical health, the psychological health, the social health, and the physical environment. And so if you look at the results, there was an increase in the various domains of the mean quality of life at looking at the physical, psychological, social, and environment at baseline and endline. But the results showed that there was significant increase in the social and environmental domain. However, when it comes to the overall quality of life, for the arms of the study, we realized that those who didn't receive the intervention had their quality of life dropping at endline, while those who had the intervention had significant increases in their quality of life, resulting in an overall quality of life increasing from 88 from 0.3 to 94.0 at endline. To be able to examine the effect of the intervention using the DID, the model showed that those in the control arm had a negative effect, while those who had received the differentiated service delivery intervention and the short voice messaging intervention had significant effects on their mean quality of life. So for those who had a DSD intervention, their mean quality of life increased by 5.8, and those who had a short voice messaging intervention had their mean quality of life improving by 10.2 within the 16-week period. In terms of the predictors affecting quality of life, of course, receiving or being in any of the intervention arms where they were more likely to have an improved quality of life as shown, and then being depressed, taking other herbal medications to treat for HIV aside ARVs, having a comorbid condition were all negatively associated with quality of life. And so in conclusion, we've realized that Having the differentiated service delivery and mobile interventions helped improve the quality of life of women living with HIV. And so as a way of recommendation, we recommended that the Ghana Health Service, through the intervention program, should review their policy guidelines to integrate mobile technology as part of their DSD package to not only women living with HIV, but to other segments of the population. And then also a key recommendation is for them to train their service providers to provide tailored care for persons living with HIV, because when you get to the ART, services are provided to everyone, but this study showed that differentiating the care is going to yield a lot of results. And so currently, as we speak, where the study was undertaken, those who had a DSD, they continue to run the intervention. It's been sustained and it's running and it's yielding a lot of results. So the control program, as a recommendation, should try and scale that up to help improve the well-being or the quality of life of persons or older persons living with HIV in the country. I acknowledge the following people who made this work possible, especially all participants who participated in the study. Thank you so much.